Hi, Jenny.
Hi Lou, how are you doing?
Yeah, I'm really good, thank you. It's really nice to see you today. Thank you so much for sparing time out of your exceptionally busy schedule. So thanks for fitting us in. Um, I know that what we're about to talk about today is something that you and I have discussed lots of times over the years that we've known each other now, and it's a topic of conversation that I think has become more and more relevant over the years, and perhaps something that as I started in recruitment has become really the basis of every reason that candidates want to move on from their existing role. And I think that I guess as a nurse, it's the one thing that you beat yourselves up over, that you strive for
Perfection.
perfection. That's the word I'm looking for. You strive for perfection, which in reality just doesn't exist. And so I think that I think it's really important that we address this issue and that we talk about how you can't avoid mistakes, but how you learn to live with them.
Yeah, and even embrace them.
I think so. I mean, I think, we all make mistakes, don't we? We've just seen I've made a mistake in not preparing myself properly. But I think that certainly in the healthcare sector, it's something that is talked about all the time. And I think depending on the type of environment that you're working in, they can be positive or negative. And I think it's really important that we talk about what you've been doing to help nurses with embracing those mistakes. So let's start by talking about why mistakes happen. Why do they happen?
So the first thing that comes to mind is an experience. We met when I would have classed myself as a baby nurse. I was maybe a couple of years qualified, but that's not long. That's not much experience. And I found myself in a situation where I'd made my first drug error as a nurse. It was compounded. I think the fear of it was compounded by me having less knowledge around medication. So I had less knowledge around the consequences that patient would suffer at my hands. I basically gave them one of their evening drugs in the morning, and that drug did have some slight sedative qualities. I noticed as soon as I went back to sign for the drug that was meant to be given at 10 p.m, not 8 a.m. Horrible sinking feeling. Everything just stops, and it was as terrifying as I expected it to be. We're all warned that you're not a nurse until you make a drug error.
Yeah.
And yeah, it really hit me in that situation. So firstly, I went to the patient and apologized, explained what had happened. The patient was wonderfully charismatic and was saying, like, let's just keep it between you and me. Because I was saying, well, I'm going to tell the doctor, I'm gonna let the manager know what's happened, but I'm going to take your physical observations. I'm going to speak with the doctor just to make sure that there's going to be no interactions with the other medications that I've given you this morning. And she's like, oh no, I'll be fine. Just between us. And so I was given every opportunity to just sweep it under the carpet, but obviously not the right thing to do. I'm not medically trained to the extent that I'm going to understand, even if I'm an experienced nurse, whether I'm going to understand whether that drug's gonna interact with other drugs that that patient's had, whether they're gonna have more serious consequences later on. So I followed the due process, and then later on found myself being called for my mistake and needing to write a statement, and having to reflect back because I'd not written an incident form for the situation, even though I'd reported everything and I'd followed up on everything. There was that documentation missing, and unfortunately I was working as an agency nurse, and so the client was wanting to make sure that my agency gave me some sort of disciplinary action or stopped me going back there. And it was truly daunting, and I was lucky to have you as a line manager that would look on that compassionately and see that I was able to own up, and I was able to learn from it and develop from it. And so luckily I didn't face any consequences other than choosing not to go back to that environment to work for that leader again.
Yeah.
So yeah, I've truly been there and done it, and that's not the only mistake I've made in my career. There have been many, unfortunately. So inexperience is one. Also, we are working in an absolute pressure cooker where for some people they make a mistake at work and there's not that much of a consequence to it, whereas unfortunately health and social care professionals, they have lives in their hands, and these are human beings that we're dealing with, and so the ramifications of our errors can be really serious, and that puts pressure on us and if anything makes it more likely for us to make errors. We're going into unique situations all the time. There's different environments, the environments are changing constantly. There's different teams, different team dynamics all the time, given that people have their own personal things going on outside of work, and that's going to impact on their stress levels within work, which is going to impact on their performance. And we multitask, us nurses, we multitask like good uns. So there's only so much that we can juggle before something gets dropped.
Yeah, absolutely.
Yeah, and we're in a pandemic. I could just slide that in as well.
I think we have to talk about the pandemic, don't we? It's, you know, you can't not go a day without talking about the pandemic now. But I think, you know, you're absolutely right in terms of the environments that you're working in, and there's so much that can contribute to those mistakes that you've got no control over. And it's, you know, it's that we talked about this being sort of a sliding doors effect, didn't we, in all of these things lining up that culminate in a mistake. But had anything changed along the way, then perhaps that wouldn't have happened. And I think moving on from that, the next important question, I guess, is why mistakes can be a positive thing. I mean, I think we talk about mistakes with a very negative connotation, but actually mistakes can be and should be a positive event.
Yeah, not only a positive event, but an absolute necessity as well. As teenagers, we're given higher levels of dopamine in our brains, and that's to force these mistakes so that we then learn from them and we develop into adults that are confident and competent in adulting, believe it or not. but the mistakes that we make when we settle into adulthood and we settle into our careers, they are huge opportunities for learning and for growth, just like they are as we're learning to be adults. And so it's for the betterment of patient care and for the betterment of the services. And this is where a lot of the policies have evolved over time. It's learning lessons from mistakes that have been made, things that have been done with the best of intentions that just haven't had the desired outcomes. And also it stops things from getting worse as well when we own up to our mistakes and we deal with them in the right way and in a positive way. It makes sure that we get the best from them. So by me owning up about my mistake about the drug error, it stopped things from getting worse. It stopped things deteriorating with the patient, and it just made sure that there were enough brains put together to make sure that things were getting no worse, and that the patient was monitored and looked after properly from there on. And it also led to changes in the way that the drug charts were written up, so that people who were coming in who were new to those drug charts would understand them easier. So there are improvements from it. And it's also, there's a lot to be said for role modeling and adding and contributing to the culture in your workplace and making it okay to speak about these errors, because it can feel very, very lonely when you make a mistake. Even now in practice, when I make a mistake, I feel singled out and I feel alone with it. And actually that's not the case. We're never alone in making our mistakes. There's usually been a plethora of things that have led to it. It's usually been a team approach, and often being able to talk about it opens up a culture where it's okay to have these discussions. It's okay to talk about the things that go wrong and talk about how we're going to avoid that and how we're going to help our colleagues learn the easy way going forward. And people respect the honesty as well. It takes a lot to talk about it, but actually when you do, it's that snowball effect. So it really does make a difference.
Absolutely. And I think as much as we can talk about how mistakes are a positive event, and we can try to help mental health professionals, any health and social care professionals, to have that ability to view it positively, there are going to be factors that negatively affect a person's ability to address their mistake.
Yeah, definitely. And I think confidence is a huge one. Having the confidence and being in the right setting to be able to own your mistake without that fear of persecution and that fear of negative consequences. Previous experiences as well. If you've made a mistake and you've not been treated well and you've not been treated compassionately, of course any human is going to be less likely to want to own up to that mistake going forward if they make another one, or if they make a similar one. And also leadership styles and blame cultures that develop can make it incredibly difficult to speak about your mistakes.
Yeah, and I think by lots of people, and certainly what we hear and see, is that mistakes are viewed by many people as personal failure. It's something to be ashamed of. They've let colleagues down. They've failed in patient care. And I think you mentioned a word there earlier about being treated compassionately. When you have made a mistake, you have the right to be treated compassionately. These mistakes are not deliberate. They're often, as you've described, at the result of multitasking, working short-staffed, doing 20 different jobs, having new members on the team, having a new patient arrive, and probably all at the same time as well. That lots of outside factors have affected what has culminated in a mistake. And I know, during the time that we've worked together on and off now for years, we have talked many times about mistakes and how they're dealt with and how you pick yourself up after you've made one, especially if it's had a knock-on effect to patient well-being and there's had to be some additional monitoring. And I know that that's now influenced where you're starting to go in your career, and with Educate and what you've set up there, to address what individuals can do to take back that control. So tell us a little bit about what you're starting to do now, and what you're offering to nurses.
Yeah, yeah. So there's a lot to cover there from that question. So no problem. So first of all, it took me a good year to rebuild my confidence when I was that baby nurse who'd made that drug error. It really, really did hit me hard. And you're right, Lou, I take personal responsibility for the welfare of my patients, as I should to some extent, but not to the extent where I beat myself up so much for the mistakes that I make, because they are just part of that learning process. And that's been a really, really hard lesson for me, is to learn not to take things so personally. And I can think, even going back a couple of years ago now, I was working in a team who'd worked really hard to discharge a patient. He had multiple substance abuse issues. He had secondary, or what were considered to be secondary, mental health problems that had been stabilized over the couple of weeks of his admission. He was now had full capacity and was dealing drugs to the vulnerable people who were on our unit. It was spoken about in length at ward round about whether he still needed to be in this acute ward, or whether it was best for him to be discharged with community support. And the feedback after ward round was that he could be discharged on that day, or he could be discharged the next day, depending on how long it took to get everything in place. And so me and the team worked really, really hard that day to pull out all of the stops and get him discharged sooner rather than later, which is what the patient wanted and what we wanted for the well-being of the other vulnerable people on our unit. So we pulled out all the stops, we did everything thoroughly. I opened the door for this chap, and he went out of our unit. We discharged him. And a couple of days later, we got a call to say that he'd passed away from a drug overdose. And it really, really shocked us. It shook the whole team. And I remember being sat in the debrief, and my exact words were, I discharged him. I opened the door and I discharged him. I took full responsibility for that, despite the fact that there was a multidisciplinary team behind us. And sometimes we do get these undesirable outcomes, and luckily the mistake wasn't in what we did that day. The mistake wasn't in discharging him, because that was risk assessed and it was executed perfectly. But my learning from that was more about how I phrase things and how I take responsibility for things. Not only does that impact on my well-being, but I'm also role modeling in that language about just how we hold ourselves accountable for these team decisions. And it's not healthy. It's not healthy at all. So that reflective practice is really important. And I find even after having debriefs, I reflect personally following the debrief to just think about what my takeaway from that is as well. And that can be really helpful. And for the people who are struggling to find the confidence to talk about mistakes, to talk about things that could have been done better, start by finding someone that you feel safe with. So build that network of other nurses that you've got, even external to your organisation. Stay in touch with people when you move on, and speak to them and see what they would have done in those situations. And even if they wouldn't have done what you did, they will usually be able to see why you did it. And also to think carefully about who you work for. I've worked really hard over the last few years to make sure that I surround myself with people that I feel safe with. And they are the same people that I bounce off of and that I work really well with and achieve the best outcomes for my service users with as well. So I would say have confidence to be able to move on. And I think that's easy to say as an agency nurse, but for those people who are in those full-time positions, it is worth putting the effort into just finding out if there's different places, if it's time to have a change. I think that keeps us healthy as well, because it's an opportunity for growth, and it's an opportunity for you to transfer your skills into a different area and have new challenges. And sometimes that fresh start with a new team can be really helpful as well. And to have compassion for yourself and for others through it all. It can feel so lonely when you've made that mistake, but it's not the beating yourself up that brings the learning. It's putting your hands up, it's speaking to your colleagues, and it's thinking about what you're going to do differently next time, and being in a clear headspace where you can act on it and you can do things differently and make those new behaviours. So I could talk about this for absolutely hours, and I do often, because I actually run resilience courses, just looking at how nurses can nurse themselves and nurse each other, how they can bounce back from adverse situations. And I really enjoyed teaching a group of nurses face to face last week about this. And so I'm looking forward to doing more face-to-face sessions on this, and supporting nurses to have perhaps learn from some of my mistakes, and think differently about how they address things and how they learn from things.
Amazing. I mean, I think it's, I mean, I've spoken with people that have been on one of your courses and what they got from that course, and to have someone like you who's been there and done it and knows what it feels like. You know, you talked about that sinking feeling when you realize what's happened. And I think, you know, that there are some great employers out there that are really putting a focus on well-being and mental health at work, and it's the buzzword at the moment, but there's still an awful lot of work to be done in identifying those companies that do that as a tick box exercise to just say, you know, we've covered that. But you run courses to individuals. It doesn't need to come from their employer. They can come and do one of your courses independently. And when we post this interview, we're going to put all of the details of where they can find out about your courses and sign themselves up to one of these courses, and hopefully get some huge benefit from building up their own personal resilience, and helping them to control what they can control going forward.
Yeah. Clearly, with the burnout rates, given the pandemic and the national shortage in nurses, we cannot afford to lose any more of our valuable colleagues. So we need to get together and we need to support each other, because we can't nurse ourselves.
Yeah, absolutely. Jen, I could talk to you about this all day, but I have taken up enough of your valuable time. So we'll make sure that after this, we get all of the information from you, and we put all of those details along with the posting of the video with links to your website and everything. So we'll catch up afterwards about that. But thank you so much for your time today. As always, it's been an absolute pleasure to talk to you.
And thank you. Thanks for inviting me.
Thanks, Jenny. I'll see you soon.
Okay, bye.